So this is a great question, putting implants over versus under the muscle. And to be fair, there's a lot of gray area. There's a lot of differing opinions on this. So this is simply just my opinion and the way that I think about it as a plastic surgeon. The most important determinant to think about when you think about putting an implant over versus under the muscle is how much native breast tissue you have. The whole idea behind putting an implant underneath your pectoralis major muscle really has to do with patients who have very little of their own breast tissue and trying to gain extra coverage on top of the implant. Anatomically, the part where that matters the most is up top here, and that matters the most for two reasons. Number one, that's where the tissue tends to be thinnest, so that's maybe where we want the most coverage. And number two, that's the very most visible part of the breast in most normal clothing. But what happens if you don't have a lot of your own native breast tissue and you have an implant there? What we worry about is a very unnatural step off. So basically kind of rib cage, chest wall, and then sort of an implant just sitting there. So traditionally, we would measure the amount of tissue on the top of your chest, and then we would use that to determine whether or not we put an implant below your pectoralis major muscle or above it. If you have enough of your own breast tissue, then it really doesn't matter from like an aesthetic perspective whether or not you put an implant above or below your muscle. So there are also other factors to consider, and it really has to do with the type of the implant that you use. You use an implant that's stiffer, then you are more likely, if you go above the muscle, to get an unnatural step off. You also worry about a saline implant if you're going above the muscle, because a saline implant has a potential to ripple, and if you don't have that added muscle coverage, then it's potentially more visible in the more visible areas of the breast. Now, there is definitely a push to get away from putting implants underneath your pectoralis major muscle, because what you're doing is you're changing more of the anatomy. You're putting an implant underneath the muscle, which means that every time you fire that muscle, it's going to hit up against that implant, and you run the risk of getting an animation deformity. So what a lot of surgeons are doing now, if they're putting an implant above your muscle in a patient with relatively little breast tissue, is they're also adding fat grafting. And so fat grafting is going to kind of take the place of what that muscle was traditionally doing, which is basically to thicken up the tissue at the top part of the breast. Yeah, I hope this helps to answer this question. If you guys have any other questions, definitely leave them in the comments below. I'm happy to do, a post on it. I think ultimately, I don't think there's any right or wrong answer. I think it's really just having a really thorough discussion with your surgeon in regards to what your preferences are and a kind of a detailed discussion about what your anatomy looks like.